fill this area here a little bit. As you can see, I lost the hair here. Still got some on my back, but you know, the one in the front is gone, so that's what I'm trying to accomplish here.
Now, Alex is a perfect candidate for hair transplant. He's got nice dark colored hair. He's got excellent density back here. He hasn't lost everything, and somebody who's lost everything aren't great candidates. So Alex is a very, very good candidate. You can see he definitely has some recession and some loss up in here. So what we do is we take some of the hair from back in the back here, and again, he's got good density, he's got good donor hair back here, and we move it up into the front. And we recreate a frontal hairline, and we thicken the hair that he's got right here. You can have somebody who's got loss back up in the vertex, and we can do hair transplant back there, but people who are the best candidates are ones who particularly have a loss right up here in front. So I think this is going to work really well for Alex. Okay, once the the strip has been harvested, the strip is taken and bread loafed, where small slivers are created. You can see that our technician, with meticulous care, careful not to transect or cut the follicles. Once the slivers have been created, then the individual hair follicles are made. And care is taken not to transect the follicles, to make sure that each of the individual hairs are preserved. And that the grafts are of a size that they can be placed easily and stay in position. Okay, so now we're going to go ahead and create some of the sites. And again, the angle that you make these at needs to parallel the previous follicles where his hair is naturally growing. And you want to break up the hairline so it gives a completely natural appearance. Down in this area here, the hair tends to grow out at more of an oblique angle. So if you make your hairs this direction, it's not going to look natural. So down in this area, then we have somebody record for us just to make sure that we keep track of the appropriate number. Okay, so this is the angle that we want to create them at. So we count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 18, 19, 30, 1, 2, 3, 4, 5, 6, 7, 8, 9, 50, 1, 2, 3, 4, 5, 6, 60, 1, 2, 3, 4, 5, 6, 70, 1, 2, 3, 4, 5, 6, 7, 8, 80, 1, 2, 3, 4, 5, 6, and 90, 1, 2, 3, 4, 5, 6, 7, 8, 9, 100. Once the individual grafts have been harvested, placement is started. You can see here all the recipient sites have been marked out. The grafts are blue because the color of the hair is too light, and so it's darkened with this blue color called methylene blue. And this blue color is all, of course, going to go away within a week or a couple weeks as the scabs fall off. So this is Alex at about 9 days after surgery. can see what the little grafts look like. The little scabs have fallen off, and you just see these little short hairs, almost like he has a crew cut here. These hairs will actually fall out about a month after surgery. Over time they get thicker, coarser, and increase in the number, the count, back up to pretty close to what it was before. The studies have shown that about 98-99% of the grafts will generally survive, and they get thicker and coarser over the course of time, and it takes up to a full year before you see the full effects of the regrowth of the hair. You can see that already it's difficult to see that Alex has had anything done. So this is the incision in the back. This is the stitch that runs along the whole incision. You can see that already it's so well hidden. Once the stitch comes out, you can't really see this incision back here either.